Yes, so if we hear the song, it means that we are live on Q95. A special good evening to you and welcome to episode number 6 of Roots Connections on Q for today, Wednesday, July 28th, 2021. I am Simone Matthew, and tonight we are joined by 3 of our top medical experts from the Caribbean as we discuss vaccine hesitancy and the impact on the economies of Dominica and the Caribbean region in general. So our experts this evening are from PAHO, the Pan American Health Organization, Dr. Yitdes Gebrey, and we want to thank Dr. Carissa Etienne for recommending him as an expert to join us this evening. And we also have Dr. Swinburne Augustine, who is a microbiologist and immunologist, as well as Dr. Wilhelmine Adrien, who is a public health specialist. So they're here with us this evening as we talk about the vaccine hesitancy that we see all over the world. But in particular, we will be focusing on the Caribbean region and the implications for us as Caribbean people. So we thank them for taking time off of their busy schedules to join us, and they will introduce themselves in a little while. But before they do, let me say a pleasant good evening to you wherever you are joining us from, whether you're listening via Q95 radio in Dominica or you're listening via the Q95 websites, q95da.com. Pleasant good evening as well to my Push Past 10 and DA Rose Facebook Live Nation. I know that you will be here soon. You will be coming on, and we are looking forward to interacting with you via the Facebook Live comments as well as your call in on the radio station. So you can always call us about 9 p.m. this evening to make your contributions to the program. And don't forget, you can also join us now on Facebook at Wise QFM. So you may have known by now that most of our programs are streaming live on Facebook via the Wise QFM Facebook Live platform. So you can always join us on Facebook for most of our programs. And remember to share the live. Tell someone to tell someone that we are here for this very important discussions. So we look forward to engaging with you this evening, whether it's via phone or via the Facebook Live messaging. And we say a special good evening and thank you to Mr. G and the Q95 FM family, as well as Lambi, who's on the console and will be taking your calls about 9 p.m., as well as Mr. Sherwin Norris, our engineer, who keeps us connected to Dominica via our various Q95 platforms. So there's so much to discuss. You know, COVID-19 continues to rage around the world, and we will try to get this pandemic under control. So let us welcome our guests, beginning with Dr. Gebrey as they tell us who they are. So Dr. Gebrey, welcome to the program and thank you for being here.
Thank you very much, and good evening to you, and good evening to your listeners and my colleagues in the panel discussants here. I am Yitdes Gebrey, as been mentioned, the PAHO WHO representative for Barbados and the Eastern Caribbean, and also for Dominica as the concurrently the representative there. In absentia, even though our office is in Barbados, we also provide direct technical cooperation in Dominica. So I'm very pleased to be here and to be with you. Thank you very much.
Yes, thank you. And thank you for being here with us as well. We look forward to your contributions. Dr. Adrien, can you introduce yourself, please? I think you're muted, so let's try to unmute your mic. You may be muted. Okay, let's go over to Dr. Swinburne in the meantime, and then we'll come back to you, Dr. Adrien. Oh, there we go. There we go. Oh, you just got it. Yes.
Sorry. Yes. So I'm Wilhelmine Adrien from Dominica, and I have pursued studies in public health, and I achieved my doctorate degree in public health. Although currently I'm not actually working in the public health division, but I'm still working as a nurse in the community. My current position now is as team director, and I pretty much deal with home health and hospice and palliative care to patients.
Yeah, so welcome and thank you for being here, Dr. Swinburne. I think you might be muted as well.
Thank you for inviting me, Simone, and thank you to your listeners everywhere in Dominica and wherever they may be. A lot of Dominicans may know me. I know a lot of Dailies people know me because I'm from Dailies and went to school in town, was a policeman for a long time in the SSU and left, joined the US Army and did nursing there, and then went on to school to study and become a scientist, a microbiologist and immunologist. Right now, I work for a federal agency and I am doing research on trying to determine public health impacts of what's going on around in our environment, what we breathe, what we drink, what we eat, how those things affect us. And so I've been very active with COVID. I've been on 2 deployments with the Federal Emergency Management Agency to Arizona and to Washington State to help with drawing up vaccines and also with educating the public on vaccine hesitancy. I've also been on on your program and a lot of programs around the Caribbean on Trinidad and Tobago TV and Jamaica TV and helping St. Eustatius Saber with their pandemic planning in the event of a natural disaster. So I've got a plate full, but it's a pleasure to do that. We want to get out of this mess.
Yes, absolutely. And I want to thank each one of you for being here. And we can see that the Facebook Live is already getting crowded. The room is getting crowded. So we have Rosalind Sevre. Good evening to you. David Joseph, Sandra Norris, Carl Kofi James. So we want to thank Tina Bell. So we want to thank everyone who has logged on to the Facebook Live. Don't forget to share this information as we talk about the vaccine, the hesitancy surrounding the vaccine and the impact that is having not only on our economy, but our mental health as well. So here we are again, right? Here we are. Just when we thought we were out of the woods with COVID-19, life was about to return to some semblance of being normal again. We are right back to talking about the rising rates of COVID-19, and we will explore some of the reasons why this is the case this evening, and we'll also explore what we can do as individuals to stop this pandemic in its tracks once and for all. So unfortunately, the virus is roaring back to life with a vengeance and with an even more contagious strain. As a matter of fact, I was just looking at the news this evening, and now we have on average about 57,000 new cases here in the US, and it is up by, listen carefully, 400% in the last 5 weeks. So unfortunately, we are not out of the woods, and COVID-19, which we've been battling for almost 2 years now, is very much alive and very much interested in spreading, right? So I think we can all agree that we cannot keep waking up to these new variants, which are even deadlier than the ones before. So this is why our original experts are here to guide us. We will discuss the latest updates, what we need to know with this quickly changing virus, and to address your questions and your concerns. So whether you're joining us via Facebook Live or you're planning on calling into the radio at about 9 p.m., we're looking forward to engaging with you to answer your questions and concerns. So Dr. Swinburne, let's begin with you. Why does this virus keep mutating?
That is something viruses do, and that's a very good question, Simone. Viruses, bacteria, and fungi, and all these organisms, they evolve. They do it in a shorter time frame than, say, evolution with humans. What the virus is trying to do, and that is the point I would like to emphasize to all the listeners tonight, because apparently they're not getting it. A variant is the virus trying to change so that whatever antibodies or treatments, therapeutics we use will not work. Basically, the virus wants to live to keep killing us, and we have to keep fighting to prevent it from doing so, to stop it and to block it from replicating and to block it so that we can go back to some sort of normalcy. As long as people are allowing the virus to replicate inside of them, every single time there's a chance that it will change to the point where none of the vaccines or the treatments will work, and we will end up right back in a lockdown. We can already see that happening. We can already see states and agencies bringing back the mask mandate for indoors, whether you're vaccinating or not. So we have to be really, really careful and not allow the virus to do that.
Yes, absolutely. Absolutely. So as of today, and I invite our other guests as well to feel free to join in on the discussion, because this is an open discussion that we're having this evening. So as of today, do we know how many mutations there've been of this particular virus? And is this normal? Do viruses, is this unprecedented? Have we seen this in the past, where viruses just keep mutating? So how many mutations has there been? And is it normal for viruses to mutate so often?
Right now, there are about 120 known mutations or more. You will hear about the lambda mutation, the delta mutation, the alpha mutation. There are all sorts of mutations. Thank God, none of those have been able to evade the immune system and to evade the antibodies that the vaccines caused us to produce.
Yes, excellent. Thank you for that. So will we continue to see variants as long as people are not vaccinated?
That is absolutely correct. And that is the fear of all public health officials and all scientists. It is that the virus wants to live, it wants to change, it wants to evade. We are actually in a battle with a virus. We have to create tools and weapons to destroy it, and it is trying to evade those weapons. It is as simple as that. And it will keep doing it as long as there are people who will allow it to do that, people who are unvaccinated. And that is a really troubling and dangerous thing for us to be doing.
Yeah, absolutely. And despite many efforts, we attempted to have someone join us from the Dominica Health Department, but we were unable to get someone to join us. But it seems like as of now, we have about 13 active cases. So I'm always concerned that with such a small number, we might think that we are immune from this pandemic, from this disease. And that is simply not the case, because we've seen other cases where the numbers were relatively low until they spiraled out of control. So first, we want to commend the healthcare workers in Dominica and Dominicans in general for everything they've done to mitigate this virus, to ensure that it doesn't become as huge a pandemic. But it always concerns me that we think because we've not had a major outbreak that we can relax and not be as concerned as the rest of the world. So Dr. Adrien, I want to come across to you, and if you can tell us about the latest infection rates here in the US, and also, the vaccination percentages here in the US as well. I think you're muted. Good.
Yeah, in the meantime, may I speak a little bit about the variant?
Yes, please do.
Yeah, thank you very much, Dr. Matthew. The first issue about the variants, even though we have so many numbers of changes or mutation of the virus, how do we know which variants are important and which are not? The most important thing we have to look at. WHO has provided a working definition of a variant of interest and a variant of concern. So this is for a reason, because some of these variants do have a focus and efforts for public health significance. As you know, currently we are now much concerned about or worried about the variant called Delta. These were based on the different types of changes the virus has done. The first thing is that, as earlier mentioned, why do the viruses change, mutate? It is the pressure they are in. They wanted to continue to multiply, replicate, and then continue to attack people and then affect people. Therefore, if we have a more susceptible population, meaning that who are not infected or vaccinated and then having the immune response properly, they will continue to multiply and then change and evade the immune system. So that's why they are mutating. So the first one is the variant of interest. And this variant of interest, that mutation has taken place, and then that suspected or known cause of significant change has not taken place as yet. So therefore, this would be circulating widely, known that it may cause cluster of infections. However, it could be in some countries, but not widely creating havoc in our health system or in individuals. So that is a variant of interest. On the other hand, we have also the variant of concern, like the Delta one or the Alpha one, Beta or Gamma one, at least 4 of them, which we have now, including Lambda and others. If it is known to spread more easily than the other variants, and then cause more severe disease and escapes the body immune response, then there will be some changes in the clinical presentation. That is the time we have to be concerned. And then that's where we have now the so-called variant Delta, which creating new surge of outbreak. Back to you. Thank you.
Oh, thank you so much for that explanation, Dr. Gebrey. We appreciate it. Dr. Adrien?
Yes. So I'm just going to give you briefly the breakdown of vaccination in America. So we have at least of persons receiving at least one of the vaccine, one dose, is 57% of the population. To be exact, America has a population of about 330 million people. So out of these, we have a total vaccination of 49.3%. So that means only 49% of the population are fully vaccinated, and 57% have at least received one dose. Of the population greater than 12 years of age, we have a total of 66.8% of that population being vaccinated with one vaccine, and fully vaccinated would be a total of about 57.6%. Of the population 18 years of age and older, we have 69% who have received at least one vaccine and 60% receiving full vaccination. And the population 65 years and older, we have 89.6% receiving at least one vaccine, and 79.9% are fully vaccinated. So if you look at the numbers, while the general population is still less than 50%, in the subgroups, we have quite a bit of those vaccinated fully above 50%. So those greater than 12 years, we have a 57% rate. Those greater than 18, we have 60%, and those above 65, we have a 79% rate, which is pretty much remarkable. But we can do better. We can do much better than that. And in terms of the infectious rate, it's climbing on an average daily rate. Well, daily, we have we have new cases of about 68,000. Yesterday, we had 68,071 new confirmed cases. In terms of the daily decline or the daily deaths, we have a total of about 2,000 deaths a day. So that is pretty high for a population that is almost 50% vaccinated.
Because again, the Delta variant keeps finding the unvaccinated people and spread it via the unvaccinated people. So it's certainly a point of concern. Now, Dr. Gebrey, we know that the rest of the Caribbean, like Dominica, is struggling to get this virus out of control. What can you tell us about PAHO in general and its role as it relates to this worldwide pandemic?
Okay, thank you very much. The Pan American Health Organization is the regional office for World Health Organization. We provide technical cooperation in this region of the Americas, about 55 countries and territories, and for our member states, which also Dominica is a member state. So our main priority is to save lives. And then, as you know from this discussion, immunization in Latin America and the Caribbean should be a global priority, and all countries need to vaccinate and then need also vaccines in order to save lives. COVID-19 infection has surged in the Americas. Therefore, what we do is that strengthening the health system. It has devastated the health systems, especially in 2020, and currently in many countries in the Southern and Central America, struggling to cope with the increased influx of patients. Therefore, PAHO provides technical support, financial support, including providing in all those countries. If you are in outside of the United States, Canada, and most of the vaccines are delivered through PAHO. So to date, I am very happy that over 300 million people have been completed their vaccination in the Americas, but only 36% are from Latin America and the Caribbean. As you mentioned, it's less than 17% in the Caribbean, actually, who have completed their vaccination overall. So there could be some differences from country to country, even in the Caribbean. And some territories like Cayman and others may have even reached the highest percentage of 60 over 70%. So the second area we are working is that we are enabling an effective response, deploying vaccines, healthcare workers, emergency medical teams where it is needed when we have surges. So several variants, as you know, of concern has been spreading in our region. Therefore, providing the COVID tools to stop the spread of infections, testing for PCR, personal protective equipment, and then oxygen supplies, treatment, including corticosteroids like dexamethasone and others. We provide all those to the countries who may need it at the time of through the inclusion in solidarity. So PAHO is the regional public health agency. We work with the countries, and the countries depend on the delivery of the vaccines at this point in time. That will be our main priority. Back to you.
Yes, absolutely. Thank you for sharing that. Now, it is also important, and I think the major part of what we want to do here this evening is to consider the reasons why folks are not getting vaccinated. So let us share now on some of the myths, the misinformations, the conspiracies that are out there in terms of why folks are not getting vaccinated, and we can talk about the reasons why they should. And with that, having said that, I will be be sure also to look for your comments on Facebook so you can join in this part of the conversation as well. So if anyone wants to join in, what are some of the myths that we are hearing about and how we can address those myths?
I would just want to go first. Okay, so one of the myths, or well, I wouldn't say a myth, but people are of the opinion that the vaccine was developed too quickly. I'm going to ask Dr. Swinburne to review exactly what he said at a previous program that we had in terms of people thinking that, oh, well, COVID came out in December of 2019, and there we are almost a year after, then we are vaccinating people. So some people are under the impression that it was done pretty quickly or too soon. Dr. Swinburne, do you mind answering that question?
Not at all.
Thanks.
That is something that we've been battling for quite a while. In 2000, in the year 2000, right, I was at Meharry Medical College in Nashville, Tennessee, and I was actually, my thesis work was on finding the mechanism of infection for Chagas disease, which is in South America. Dr. Gebrey will probably know that better than most of you guys. Chagas disease, there's no cure for it. And I used mRNA, DNA, and protein work to identify a protein on the surface of Trypanosoma cruzi, which is the agent that causes Chagas disease. That protein, which I call T1, T cruzi 1, is on the surface of the parasite, and if you block it with an antibody, the parasite cannot go into your cell, and it cannot cause infection, pretty much like what is happening with COVID. So mRNA, DNA technology is not new. Now, we've been working on since the very first SARS. We've been trying different strategies and different research designs to try to find a way in case one of those coronaviruses came back, and sure enough, here's one. Notice that when the attitude of Asians versus those of us in the West was different, because those people in the East, they had already seen those organisms before with the MERS, the Middle East respiratory virus, and with the SARS-CoV-1. That is why this one is called SARS-CoV-2. There are a number of, it's not just 2, 3, there are a number of coronaviruses that we're looking at. Just like Dr. Gebrey said a while ago, some things we see happening in certain parts of the world, and they may be of significance. Other things we can just look at, but others we have to address, because with global communications, global travel, and the age of globalization that we're in, something that is over in China today, within the next few hours, will surely be here. And everywhere else an aircraft or train or truck can travel, it will, you're packing it with you and you are carrying it with you. So I think we have to be mindful of how we address and how we behave in this environment.
Yes, absolutely. And thank you for sharing that. Now, let's also talk about some of the side effects of the vaccine, because that is an area of concern that we often hear about. So from blood clots and any other side effects that you have heard out, how do we combat that information?
See, every single medication on earth has side effects, from Tylenol to aspirin to vaccines. None are perfect, but what determines the kind of effect you have. What we don't know is what is occurring inside of people. What are their health conditions? We don't know because some of the people don't even know they have existing conditions, because a lot of people don't even like to go to the doctor to get their physicals. And only when something bad happens, and it's probably too late, that's when they run to the doctor. So, you know, it is very troubling that people take this pandemic so lightly and take information from people that are not experts in the field. Look, and I will keep saying that. If I want my car fixed, I go to the best mechanic I know. If I have a heart attack, I will not go to that mechanic. And I will not go to my pastor. I will go straight to the nearest emergency room and look for a physician or healthcare expert to take care of my heart attack. And we have to really know that there are certain people have certain fields. Farmers, they farm, fishermen fish, medical doctors and nurses, they're on the front line. People like Dr. Gebrey, even the person who is there controlling the show tonight, controlling all the equipment so that this happens, that is their field. And we have to back down and say, we have to listen to the public health experts who have dedicated all their lives for just reasons like this.
Yes, yes, and that brings in very nicely the concern of social media, because as we know, social media has been fueling a lot of the myths and information that we see out there. So I think that you're certainly correct that we have to be highly selective of where we get our information from and just who we choose to listen to with regards to this pandemic. So, what about someone who says, though, that there are breakthrough cases, that we have folks who have been vaccinated and yet they're still coming down with COVID-19? So I think that's an area a number of us are struggling with. How do you explain this?
Simon, I would like to answer that question. From the very beginning, we said that there's a 95 on average efficacy rate. Remember, there's 5% that these people may not be seroconverting or will not be immunized because of the failure rate of the vaccine. It may be that 5% are the ones coming down with COVID again. And that's what people have to realize. It is not 100% effective. Okay, so there's a failure rate. So the failure rate could be manifesting itself by somebody else getting the disease again. And not only that, if we look at our lifestyle, so we might be vaccinated based on Pfizer and Moderna. After 2 weeks of getting a second shot, you should be fully vaccinated. That is providing you seroconvert. But look at our practices. We may still go ahead not wearing masks, not washing our hands, not distancing ourselves. So we put ourselves at risk, even if we're already vaccinated. And that is why in America now, there's a big issue, or the federal government wants to mandate people taking the vaccine before they go to work with the government, or wearing masks. We're going back to wearing masks again. While government has a big say in terms of mandating mask wearing, we have responsibilities to ourselves, to our families, to our loved ones, to at least use a mask, distance, because in my profession where I work, I'm fully vaccinated, but you will never find me outside, not even outside of my car or outside of my home without a mask. No matter where I go, I still continue wearing my mask because I have to protect those I love, those who are vulnerable, even if they are vaccinated. Again, there's a 5% of people who may not seroconvert. That means they may end up getting the virus. I might be one of them, I don't know. I was never tested to see whether I have the antibodies. I have my mother living with me, 94-year-old. I can't go out and bring something into her. She was vaccinated, but she may not have seroconverted. So again, we have to be careful in terms of the myths, yes, as you said, and even we as health professionals sometimes tend to spread false information, because I'm in health groups and I'm seeing certain things passing and I have to correct them. I have to tell them, no, that's not right. That's not true. We should take the opportunity as much as possible when you get something before us to investigate, find out whether it is truthful information or whether it's just fictitious information, because we like to spread the bad word around. And social media is really dangerous to COVID in itself. COVID is dangerous, but social media seems to be just as bad.
Yeah, and the other thing we have to consider is those who get the breakthrough cases, their symptoms, and you can correct me if I'm wrong on this, but their symptoms tend to be less severe. Is that correct?
Yes, that's correct. But
Yes,
in day
yes.
two, while they may be infected with symptoms that are not as aggressive as someone who was not vaccinated, they too can still spread the disease to other persons. So let us suppose I'm vaccinated and I ended up getting COVID again. While maybe the symptoms might not be apparent, I might be asymptomatic as a matter of fact, but I am still infected. I could take that virus to somebody else, especially those not infected and they come down with the disease.
Absolutely, and thank you for sharing that. Now, Dr. Gebrey, I want to come over to you to find out if there are any guidelines that PAHO provides. But before we do, I also think it's important to address, we saw a lot of information about incentives to get people to get the vaccine. As a matter of fact, this evening on the news, I heard that New York City is offering $100 if you're willing to take the first vaccine. And this is a question for anyone on the panel. Do these incentives work?
May I take you a little bit back? I think we have at least addressed 3 or 4 issues of why people are hesitant to take a vaccine. I think you wanted to frame it from vaccine hesitancy in general, from why are some people taking the vaccine, some don't, and then is that legitimate reasons? First of all, we have, let us also start to look at globally the rollout of this COVID-19 vaccine since it started in January, December last year, and then the last 7 months. Over 3.4 billion doses have been administered, 3.4 billion doses. This is very astonishing in a short period of time. And then most of these recipients are adults. That's also another different area of work we have to look at. So the vaccines, when they were manufactured or going through the research, was primarily, they would have been also highly effective at reducing severe illness and death from COVID-19. And then that has been proven because the moment we reached a certain level of vaccination, a certain population group over the age of 75, over the age of 60, people with chronic conditions, immediately after 4 weeks time period, we started to notice the decline in mortality or death and also severe illness. So the hospital's occupancy and bed occupancy dramatically reduced. Why? Because the vaccines were working. On the other hand, new infection also rate was declining because at the same time, people were getting the vaccination. So that is the truth. Even though we have still disparities in getting the vaccine in some of developing countries versus the developed countries. So what is vaccine hesitancy? The issues which you are mentioning now. It is delay in acceptance or refusal of the safe vaccine. So we are seeing that the vaccine is safe because almost 3.4 or 3.5 billion people have taken it. And then the vaccine is available to still some places, still very, very short. When you look at the reality, we cannot just say take the vaccine because the vaccine is also not in a steady supply. For sure, in the next few months, we're going to have a good supply of the vaccines. So the next issue is that how common is this vaccine hesitancy? And then there are three issues we have to look at: the complacency, the convenience, and then confidence. I think those are the issues we were discussing, both the speakers earlier. So the confidence for the vaccine. One of the issues which Dr. Adrien mentioned is about the messenger RNA virus vaccine. Does it actually change your DNA? No, it doesn't. This is a messenger, just somebody giving you a picture of the virus to your body, and then the body to look at this picture of the virus and then manufacture antibodies to fight the virus. And then at the end of this, that picture also been destroyed. Therefore, it doesn't change your DNA. These are the kind of worried people may have been worried about accepting the vaccines, about the social media and other issues, why this kind of information is circulating. Lastly, I wanted to mention is that vaccine hesitancy, as has been described, had occurred not only now, it has happened before. It's not for the first time. What makes it different is the one you mentioned about the social media. We have penetrated globally in terms of access to information using the different mediums. So within few hours, within a few minutes, you get the information, whether it is true or fake. So that's what makes it also another difficulty. So vaccine, especially between certain socioeconomic groups, ethnic groups, when it comes to this, the acceptance rate may be lower, and then there is some suspicion. So these are the things we have to learn, we have to hear. Black African or Black Caribbean nationals in United Kingdom are taking less when you are comparing it to the Caucasians. Why is that? The same thing goes also with the Asians, Pakistanis, Bangladesh, and others. So it is not just one population group, but it will be more. With gender too, women tend not to take the vaccine compared to, and also younger age group, younger boys or girls. So it spreads also with gender, spreads across different age groups. So, and also finally, the education level. Those individuals who have less education may tend to not to take the vaccine. But we have also some extreme groups where highly educated people may also disseminate fake news about this vaccine. The socioeconomic disadvantaged individuals and others, which easily could be swayed about this information. So what is the approach to this? We have to listen to everybody and then try to manage those fears they may have, and then address it to the extent that they may change their mind and then take the vaccine. Thank you very much.
Yes, thank you, Dr. Gebrey, and I'm hoping that that's what we're doing here this evening by providing concrete scientific information that can help everyone to make that personal decision that they need to make. Now, Dr. Swinburne, you look like you wanted to chime in and add something. I think you're muted.
I think Dr. Gebrey and Will handled both of those. They handled it properly. And, we know that for African Americans in particular, there's a level of trust that's in the gutter when it comes to scientific research because of things like the Tuskegee experiments with syphilis. And but one of the things they addressed those things, right? And I think I addressed them with you on another program earlier. Yes. Before I can even collect one sample from you, whether it's saliva or a strand of hair, anything, any research project that I have to do a proposal for, to submit, I must have an institutional review board approval. I have to say everything that could possibly go wrong with the people that are participating, that I'm asking to participate. They have to consent, and we have to go through this serious review process before that project can be approved. So there's a barrier right there to make sure. And those people who are reviewing that, your proposal, they're not necessarily scientists. They are members of the community. They're pastors, they're teachers, they're people walking around, in the community, business people who will look at that proposal and say, are you going to harm people by doing this? And if it will cause harm, how are you going to make sure? Because think of the clinical trials. They had to infect those people, right? Give them the vaccines if something had gone wrong. So you have to be able to monitor them and have the equipment and staff there to take care of them if something goes wrong. So I cannot just come down to Dominica and say, let me just do some tests on you and go write a paper. That is not how that works. The international research community is a lot more complicated than that. And so to those who fear that it will mess, it will, they're using us as guinea pigs. Nah, that doesn't work. And another thing that Dr. Gebrey just said when he mentioned that I'm trying to get to the point he was making. He'll come back. Anyways, when that thought comes back, but we have to be vigilant. And yes, people are worried, and yes, people have all kinds of reasons why they shouldn't take it. It's too fast. I think that's what Will wanted me to say earlier when she said about the too fast, because I had a simple explanation for it on your first show. If I have all the money on earth, which we did, every business, every country, everything shut down, other than the frontline workers and essential workers, the only set of people that were working hard were public health people and scientists trying to figure out a way to stop this thing so that we can get some breathing room and stop all the fear. And now we have a vaccine. So for those who were praying for a vaccine, you got one. So what you gonna tell God? Where you sent it too quickly? I mean, there are people who are day and night working hard to try to solve this problem and to get us back to normal. It's not about money. None of us are worried about trying to get rich. We're trying to keep our parents and our friends and our families alive and ourselves alive. It's not about money. So
yeah, and if I could go ahead.
No, that's it.
Yes, and if I could chime in for just a minute, Dr. Swinburne, and also the technology, if I'm correct, had been in existence for at least 20 years, right? Which is what expedited the creation of the vaccine.
Yes, you had all these global experts focused on, we had to drop all our research on everything we were doing. Everything, all research stopped. We couldn't go to the labs anyways, right? So those who could go were focused on trying to look at all kinds of different ways. What is the virus doing? How can we attack it? How can we stop it? How can we limit the spread? And how can we, basically, the question is, how can we save lives?
Yes,
Yeah.
thank you for that. And yes, go ahead, Dr. Gebrey.
Yeah, I just wanted to add about this speed of research and then production of the vaccine. Yes, in the past, it would have taken many years. At that point in time, when it is done, the there are different steps or phases of production of such research. One of the phase would have taken a few years, and then the other one will follow. In this particular development of the vaccine, the researchers actually were doing concurrently in parallel phase 1, phase 2, and phase 3, the different levels of the clinical trials. On the other hand, it would have taken a lot of money. And then to raise that money, they would have taken many years. In this case, governments, different donors came and provided the resources up front. One of the process, for instance, COVAX facility, what did was at least 9 or 10 different laboratories to produce the different types of vaccines. Put the push factor was to provide money to them. Therefore, in the US, in the UK, and other places, governments also provided the resources for the private researchers and the private laboratories to produce these vaccines. So that made a big difference. So there is no any shortcut where the vaccine was not to make the vaccine unsafe in this particular regard. So everybody who participated in the clinical phases, preclinical phases, were also known what would have been the side effects, what kind of doses have to be given, when, what kind of age group, what kind of health conditions. All this kind would have been taken into consideration. The vaccine didn't come out just overnight, and then we are asking people to take. I have taken the vaccine. I have encouraged my families to take the vaccine. They have done so. So the next step is that what concern do we have? The speed of the development of vaccine could be addressed through that one. Is it religious beliefs, or is it any other racial discrimination because of the different negative experience we have, which Dr. Sweeney mentioned earlier? So all of those things. One thing is that about side effects. The routine vaccines, the experience some people may have from influenza vaccine and others, that would be exaggerated when it came to COVID-19. Yes, we have heard some kind of side effects, but they are minimum and very minimum compared to the benefits of the vaccine in saving lives and then transmission, which is decapacitating the whole world at this point in time. Therefore, the vaccine is safe and it works. Back to you.
Yes, thank you, Dr. Gebrey. And I think we're learning so much this evening, and I just want to take a minute to thank you again, Dr. Gebrey, Dr. Sweeney, and Dr. Adrien for being here. And I want to remind everyone, if you're just tuning in, you're listening to Roots Connections on Q. I am Simone Matthew, and this evening we are addressing the vaccine hesitancy and the impact on the economy, the impact on our lives in general. And I will be sure to go over to Lambi in about 5 minutes so we can take your calls if you would like to make a contribution to the program. And I will also be taking your Facebook Live comments and questions as well. So keep them coming if you're on Facebook via Push Past 10, DA Rose, or Wise QFM. We encourage you to continue sharing the live and to continue to invite everyone to come in, make a contribution, and ask your questions. So we will come over to you in about 5 minutes. But before we do so, Dr. Adrien, I want to come over to you again and just talk about again the incentives and do they work? So do we know if any of the incentives that we've seen from beer to money to cacao tea to fried chicken, unfortunately, do any of these incentives work?
Simon, for some people it may work. For some people, yes, they want the cash because remember they have been out of work for so long during the pandemic year. So it may work for some people. As to the amount of people or the percentage of people who really respond to these gimmicks, I'm not sure. I know of people getting cars or raffling cars, getting cash, getting tickets to games.
There's a lottery in one state.
Yeah, in different states, giving money, there's a lot going on in other states. So yes, for some people it's working. I mean, some people will actually take the vaccine in order to get the this cash prize or the car or whatever. How effective it is, I really cannot tell you because it's so diverse. It's so, I mean, it's in several several states. I'm really not following that. I'll be honest with you.
Yeah, absolutely, because I
But
think we should
it
be
does have
all
a positive spin because some people are actually getting the vaccine because of the gift prize that they intend to inherit, hopefully.
Yeah, and I think it should just be a matter of social responsibility. And Dr. Sweeney, let me know if you agree with me, but it should be a matter of social responsibility. It shouldn't be about getting money or getting a prize or getting some fried chicken. It should be because we all want to return to our lives as normal, and we want to ensure that the farmers and the fishers and the tourists and the tour operators that take the cruise ships all over the place, that they too can get back to work.
Yes.
Simon, I don't want to say, oh, sorry. Simon, I don't want to say that they're selfish while I respect everybody's decision to take or not take the vaccine. And especially for those in Dominica, it's up to them. Everybody, we all have a right. But my thing is, if you do not want to take the vaccine, then at least follow the protocols to wear your mask, wash your hands, and distance yourself. Because by not being vaccinated, you can be a carrier to somebody else. So while you don't want to do it, take the vaccine, and I respect that. For whatever reason, you need to take measures to prevent yourself from getting infected, and more importantly, carrying the virus to somebody else, to one of your loved ones.
Absolutely. Dr. Swinburne?
So to go with exactly what she just said, right? In the Scientific American just yesterday is a brilliant article that I posted on Facebook called titled "The Crucial Vaccine Benefit We're Not Talking About." We hit on a couple of them, and I know we're getting ready to go to break before we come back, but think about this. Remember, there was a biotech conference in Boston last year where about 175 people attended. That outbreak has been, it has been linked, that meeting has been linked to more than 300,000 infections. How many deaths, we don't know. But that was just 175 people. So basically, the reason why we have to have some kind of civic responsibility. Life is not just about us and our individual needs and wants. We are interconnected on a village level, on a regional level, on a country level, on a global level. We are connected. So especially when you're not vaccinated, you are at risk of getting infected and passing it. You don't know how many people. Do you even care? And sometimes you have to ask yourself, do I care? So basically, the authors of this story ended that in Scientific American with the message to those who remain unvaccinated should be, don't let the virus use you to harm others.
Oh, beautiful.
How
so important.
Is that?
Yeah, so important. So we're going to take a break, and just one other point I want to make. So I equate it to the same as the reason why we wear seatbelts. We wear seatbelts in this country not only to protect ourselves, but to protect those in the community as well if we get into an accident. So I kind of think about it along those lines. So let's take a break as we go over to the studio of Q95, and Lambi will tell us the phone numbers that we can call in. And while we are waiting for your calls, we will go ahead and take your comments and your questions on Facebook. Lambi, over to you. Oh, we can't hear you, Lambi.
Let's do it again. Good evening, wherever you are. This is Roots Connection. We are taking your calls right now. The numbers are 449-3095, 449-3096, 449-3097, 616-4257, 305-432-9624. And there is someone already on the line. So let's have this person go ahead and make the call. Go ahead, please, caller.
Good night to everyone.
Good night. Good night.
I'd like to thank everyone on here for their service in attempting to fight this this predicament. But I have to say that sometimes the messages are very confusing, and I think that is one of the reasons why there are so many of us, including myself, who are very reluctant to trust the authorities on this one. I look at the United Kingdom, for example, and about 3 weeks ago, they had a soccer match against Italy where they held that soccer match in a stadium with a capacity of 80,000 people, and they filled the stadium. They released these people out onto the streets after to mix and mingle with each other. About a week after that, the UK government removed all restrictions. The same has happened throughout the United States and other countries around the world. You have places like Martinique and Guadeloupe where people are protesting now because they feel that persons who have come from overseas largely have been allowed to come on holiday and to do whatever they like when the persons within their countries have been restricted. So even tonight, I'm hearing some of you saying that, you know, you have a social responsibility to get vaccinated, otherwise you could spread it to a number of persons, when we know that we have been told that even though you are fully vaccinated, it does not prevent you from receiving and transmitting the illness. And so my concern, my massive worry, I have 3 children and I've been caught between a rock and a hard place trying to advise them on this. My concern is that we have rushed into this and we really have not been told anything about long-term possibilities of consequences. We have had incidents where supposedly persons have died of blood clots and that kind of thing. There seems to be no collection of data along those lines, and everything seems to be about the push to get people vaccinated. So what I'd like to hear is a discussion on the possibility of long-term effects as a result of vaccination. I'll just close by saying, I remember when I lived in Canada years ago, there was a lot of discussion about persons who had taken injections in Canada sometime in the 60s. And as a result of those injections, their children, when they were born with their hands coming out where their elbows are and that kind of thing. So persons trusted the health authorities then and got the wrong end of the stick. And this is my fear with this particular vaccination drive. I'd like to thank you all again. Have a good night.
Yes, and thank you, caller. Thank you for those valid points that you raised, and thank you for your contribution to the program. All very valid concerns. So what I hear you say is that you're concerned about the long-term effects about the vaccine. So any one of our experts care to chime in on that particular concern?
Sure, I can. Simone, I'll be glad to address that. Everything we are learning now from COVID is new knowledge. We didn't know COVID before. We knew of coronaviruses, but not this one. We didn't understand that that virus could be spreading while asymptomatic. In 2018, I did a study in Puerto Rico on a beach called Boquerón Beach in Puerto Rico, where we collected water samples on that beach, and we also collected saliva samples. When they designed the study, they were looking for noroviruses. Noroviruses shut down cruise ships, right? That's the virus that shuts down all these cruise ships, and they get everybody off, sanitize the ships. They were looking for that in the water because they were thinking that when we studied the area, we were looking at wastewater treatment plants going to the bay. They didn't find it there. So they thought that the experiment was a failure. But then I said, oh, hang on, let's look inside the saliva because that will tell us what they've been exposed to from being in that water. And sure enough, noroviruses G11, G24, 2 strains were the highest, right? Then we had toxoplasma that they tell pregnant women not to mess with cat litter, and Campylobacter and other organisms in that, that the people they did not get sick because they had, every time they swam, it was like a booster shot. So if the right way to have done that experiment would have been to send people from Ohio or from some other place, not from Puerto Rico, send them there and see if they got sick by swimming there. So I say that to say that when we design those studies, we do it with safety in mind. I don't think any scientist has, yes, some there can be political pressure and some scientists bow to it, but most don't, because your legacy, the work that you do, especially in public health research, it has the ability to save or to destroy lives. So we take that very, very seriously. Now, as technologies change, and people can understand, think about it, because, and I'm coming right back at that color, there was a time when we would have to go put quarters on the side of the road to make a call, or get an envelope with red, white, and blue on it by airmail to mail to someplace. Now I can send, as a matter of fact, right now, people in Dailies are listening to me. And some of them are probably actually seeing me. When I left Dailies, there was no electricity there and no running water. So technology changes, knowledge increases, and there are QA managers and quality control and quality assurance people who are there to make sure that all of the things that we say we are doing when we do this research is safe and it's not going to cause problems. But there's always this little loophole, this little area where viruses can cause breakthroughs, where because of what we don't know is going on inside of people, we don't know your medical condition when we're designing those things. So we're doing it on a population level, not at an individual level. And all of what we're doing is to get the population together. So there may be areas where people will have side effects. And before, I couldn't take the flu shot before when I was in the Army. Maybe because, and I have, and anybody who's been in the military will know, they pump you full of shots, especially for when you deploy to foreign countries that have things that we don't have here in the United States. So if I was going to turn into a zombie, I must have turned into a pretty smart one, because apparently the vaccines may have helped me to get smarter, because I'm alive and I know they work. I work in that field. I mean, I could go into a thesis and explain in granular detail down to the little levels of how those things happening and why the vaccines are safe. What I don't understand is why, after a year and a half of looking at people dying, when all of us at first were afraid, and now a lot of us are vaccinated and not so afraid, and we are trying to show, look, I had my shot. My parents had it. why are we not turning into zombies and frogs and those things? And some people said that in 5 years, they believe that in 5 years, the vaccines are going to have some kind of effect. But I tell you what, the effects of long COVID are the things that bother me. Not the vaccines, the effects of what COVID is doing inside of us, we don't know yet, because right now we are concerned with stopping it so that we can find out later on. We need a break to stop it so that we can start to find what are the long-term effects of COVID, not the vaccine. That is what you should be worried about, the long-term effects of COVID, not of the vaccine, because the vaccines, we've had vaccines for smallpox, polio, measles, mumps, and rubella, and all those anthrax and plague. And, you know, I think the success of the vaccine program globally is what is leading us to be so complacent, because they worked so well before that our forebears were able to survive smallpox and measles and mumps and rubella and all these other things that are there, because they worked so well that the younger generations were not able to see those diseases and to see the suffering, but now we're seeing it. And the last point I would like to make is this. The flu shots that we take every year is from the flu of 1918. That was the flu that killed so many people globally in 1918. And it is still killing almost about 90,000 Americans every single year from 1918. If we allow COVID to do this to us, we're going to be in a very, very bad place.
Yes, thank you for sharing. And I think this is such an important question. Just give me 1 minute, Lambi. We'll take the call in a minute. Dr. Gebrey, Dr. Adrien, you wanted to throw in any thought on that question?
Well, yes, I just wanted to add to Dr. Swinburne in terms of the vaccine. Those were the days when people like us, commoners, I would call ourselves commoners, we were not at the table discussing about the vaccine. But then now we are there, we are present. So I have a voice for my people. I'm the voice for my people. So if something is not going to work, I am there discussing and I would say, no, it will not work for my people. Let us do something else. So we have representation on the table when research is being done. So I just wanted to reassure the caller that he's represented.
Yes, thank you. Dr. Gebrey?
Yeah, thank you very much for that question from the caller. It's very valid, actually. What is the long-term effect of the vaccine? That's one of the hesitancy for people not to take it. So he has also mentioned two additional points. Why also governments are changing policies so frequently. And the third one he mentioned is about monitoring of the side effects over the certain period. The vaccines, once they are out, during the clinical trial phases, they are looking also for certain side effects. What kind of side effects? Individuals, once taken this vaccine, from that day, from that hour, from that minute, would be monitored. There is what we call it the adverse events following vaccination. That monitoring system exists. We are collecting in each of, even in Dominica, as we speak now, the Ministry of Health, the immunization program collects that information and submits to the different authorities. The manufacturers throughout the years collect this information. Two terms we have to remember. One is vaccine efficacy. The vaccine efficacy is that how it refers to the time period where the vaccine, how it performs in a condition of a clinical trial. The other one is vaccine effectiveness. The effectiveness refers to the time where how the vaccine performs in the larger wide population. So we collect information for the vaccine efficacy and also for the vaccine effectiveness. So it's not just we give the shot and then we forget about what's happening. So this is one thing I wanted to mention. The changing policies also are based on science in some instances. Forgive me if I am being blunt about sometimes some policymakers may have taken the popular kind of decision making without looking the scientific evidence or the advice given by their scientific advisors, okay, the technical advisors. So a policy, you may see it, and then that could be opposite to what the intended purpose. So that's another issue. But as much as possible, the soccer games which you mentioned or the football matches you mentioned, that will be a testimonial. UEFA Cup was there. People were in empty stadiums, they were playing for so many periods, weeks, and then later on we have people coming together because everybody was vaccinated. On the other hand, the Delta virus came, and then we learned that what Dr. Matthew was saying again and again, the breakthrough. Yes, some people will be infected, but when it comes to the alpha, the virus, which the different types initially, it couldn't have been transmitted even if you are vaccinated. When it came to the Delta, the virus would be shaded from the person who is already vaccinated. That's why now we have to change the recommendation. So the policy shift is based on science. Thank you very much.
Yes, thank you. Lambi, do you have any other calls coming in? We can't hear you.
A number of calls are trying to get in. Let's see if they're still there. Caller, are you still there?
Yes, Lambi, blessings. What's up?
Pretty good. Go ahead with your call.
Yeah, with everybody, blessings to you all. It's very interesting. I'm listening and I'm frightened. First observation, there is nobody to strike a balance having to do. Somebody would say something contrary to what is being argued, not supporting what is being said. And I'm watching it on international news and I'm saying they're just, it's people, advocates for the vaccines. They're the only ones on the panel. And who is really selling it? Politicians and the media, predominantly. The mutation of the virus is in the absence of evolution. 120 mutations in less than 3 years. That must be synthetic. That cannot be something natural in nature, following the disciplines and the procedures and the methods in which nature deal with mutation based on the whole evolutionary process. So I'm frightened because we are just hearing people talking and we're not hearing anything of substance, so to speak. Next on the PCR test, having to do with its efficacy, because there's that false positive. The inventor of it warned. Why China is not on the world news? That is where it originated from. They claim it was rumored that it was in America, from America. Anthony Fauci and Obama, all of them was there playing the delicate dirty games, and then it went to China mysteriously. Why China is not in the news? Why? Why should people talk about mainstream media and the social media when you have Fox, you have One American News and CNN fighting every day, criticizing one another, saying how bad information each other are giving, and we are not talking about that, but we're talking about mainstream media. So it is very frightening. And in 3 years, almost 3 years now, the flu that killed thousands of people, as the brother from Daly, where we're from, said, why we're not hearing nothing about the flu anymore? People, how similar is the same when context is not considered and motive is not known? And the same idea in a different context leads to unequal results. And I'm saying vaccines then having to do with some attenuated part of a virus, a deadened, less strength, less force, being inoculated or vaccinating people, and then it builds up its own antibodies to recognize that. So when the real bad one comes, the strong one comes, the body is accustomed in fighting that virus. It could recognize it based on the attenuated state in which the person was vaccinated. That vaccine is not the same thing. So based on me, I'm not no virologist, no immunologist, no scientist, no doctor, nothing. But I have common sense, I have understanding. And it is not wise for people to come and try to make people believe, well, they're going back to normal when there is a new term, a new normal. Get it and check the Georgia Guidestone. Do all your research. The Georgia Guidestone, the agenda of the people who runs the world, not the politicians, not the prime ministers. Check the agenda of those people who run the world and tell me about COVID-19. Thanks for your time.
Yes, thank you, caller. Thank you for your contribution. And Dr. Swinburne, I'd like to go over to you for a response on this one, especially as it relates to the 120 variants that we talked about earlier. So if you can address that, and I also thought we might insert here the information we talked about before we started the program on if not the vaccine, then what? Because as we can see, the evidence is clear that the virus continues to spread, it continues to mutate. So something has to be done to end all of this. So I want to go over to you if you can answer on these 2 points. I'd appreciate it.
Yes, Simone, I would like to thank the caller for a number of points he made, and I will address them one by one. One is evolution. We can go into a whole thesis on evolution, but viruses and organisms, they can mutate and evolve as we speak. And as a matter of fact, that is exactly what we are seeing. The other term for variant is a mutation, which is a part of evolution. So basically, let me just explain, and the caller mentioned attenuation. The old way of making the vaccines was to take, like the flu vaccine, either use heat or chemical to inactivate it. It is called chemical or heat inactivation. That way, it changes its conformation. You see, proteins bind, things in our body, they bind in a certain shape, like a lock and key. You can have a bunch of keys, but there's one lock and only one key will fit. Well, they fit in a certain conformation. It's like opening your palms and then putting one hand and closing your fingers. What those mutations are trying to do, if the antibody is binding like this, the mutations are trying to change so that the antibodies does not recognize it and cannot bind. And the mutations that we see, in most of them are happening in the spike protein, the protein that the virus needs to bind to our cells before it can go in. So it's trying to change how it binds so that the shape of the protein, the antibodies will not recognize it. So this is your evolution. Now, to the callers worry about a global cabal. That runs the world, I would just say this. Let's simplify this whole thing. Let's make it real simple. COVID-19 has killed more than 4 million people globally in a year, in over a year. More than 4 million people, more than 609,000 Americans in over a year. That is more than all the wars that they fought. Every country that tries to play with COVID and declare victory, India and all states and everywhere else, they find that when they let their guard down, COVID flares up. And when it flares up with some kind of mutation that is more infectious. So if we just simplify it like simple logic, COVID, when an individual, I'm not talking about a population, when an individual catches COVID, contracts COVID, there is a 50-50 chance it will kill you individually, because when you catch COVID, you don't know what it will do to you individually, right? In a population, we can say, well, you know, X number of people in the 330 million Americans, but only X number got sick and died. That is the population on a population, but that is statistics. But individually, I don't want to get COVID because if I get COVID, there is a 50-50 chance it will kill me. That is a fact. All these people who have died around us and shot this world was not for fun, and it was not a hoax, and people are still dying. And it's time we put aside all these fancy talks about everything else. And the people who are spreading this misinformation that is so dangerous and causing death, I would say this: every time I go to my bosses or anything else with a problem and say, here's a problem, the first thing they're going to ask me, how do you think we can solve it? So I will throw that back at those people who are spreading and causing this confusion. Where is your solution to COVID-19? Other than the vaccine and mask wearing and trying to save ourselves, what is your contribution other than causing confusion and death? This is disturbing. Not the fact that the vaccines, 5,000 people have probably gotten breakthrough infections. That is 0.00 what percent compared to, so I would much rather take my chance. If I were to win the lottery, if I had a 96% chance of winning the lottery, I would play it every single day. Because yes, 96 out of 100 times, I would be a multi-millionaire.
Yes, so let's hold the calls for just a minute, Lambie, because we must go to the Facebook Live and take some of the questions and comments that have been coming in all evening. So we want to say a special good evening to Mr. Gordon Henderson, who is joining us on the Facebook Live. We have Carl Kofi James, and his question is, I got the COVID and give thanks my body was able to handle and fight it off effectively and pretty quickly. How vulnerable am I to any of the new variants since I don't intend to get vaccinated? Very good question. Carl, thank you for your contribution. Dr. Gebrey, Dr. Adrien, would you like to respond?
Well, very quickly, the first thing is that the infection gives you also immunity, the natural immunity by infection. For COVID-19, what we learned is that it also lasts somewhere about 6 to 8 months. So that's the study we have based on the follow-up for those individuals infected, and then what is the protective neutralizing antibodies they have, meaning that it will protect you for another infection or severe illness. On the other hand, what we know also from this vaccine, initially it would have been protecting up to 6 months, 7 months, 8 months. But now other studies are coming to show even in some small studies, we are still looking at those research papers and then reports. It could be to lifetime protection, some studies. So it's not very conclusive at this point in time, but so the vaccines would be more superior than the natural infection. The natural infection also wanes over time. The immunity from natural infection also wanes over time. Therefore, the individual who is infected could also be susceptible to the variants, which variants we have. Some people, we have also learned that they have the double infection, meaning that they could have also infected with 2 of the variants, beta and delta. So there is no clear-cut protection because you have COVID. So what the best thing for you is that once you have passed 90 days to get the vaccine, and then with that, you would have another protection. Definitely, since we are monitoring through research and others from the manufacturer and also from other health institutions, you'd have better information whether you may need a booster or not. So it is still in that phase we are. So my advice to you, it's not my job to advise whether as a clinician, but as a public health physician, my advice is that to take the vaccines once you have 90 days past the infection. I'm glad to hear that you are doing well.
Yes, and we're going to come over to you, Dr. Adrien, but let me take a couple of quick comments before we do. Martha Charles is on the Facebook Live, and she says, according to one research, the Moderna started in the year 2010 for COVID SARS. Everyone has side effects, but the benefits outweigh the risk. Then we have Sabria Senhouse, and she says New York was doing a lottery for young persons who got the vaccine and giving full 4-year scholarships to college to the winners. Beverly Johnson, thank you for joining us from California. Dr. Adrien, this one is for you. Marshall Lawrence says, good evening, Dr. Simone. Thanks for the highly important subject. While science has its role, the human body also has its parts to play. My question, why is there no mass campaigning and programs concerning strengthening the immune system? I think that is a very valid and a very important question. Dr. Adrien, can you assist us with this one?
Currently, Simon, in terms of mass campaigning to boost your immune system, it may be effective. There's no guarantee, only because initially we were talking about taking vitamin C and vitamin D, and quite a few people took the vitamin D on a regular basis, hoping to boost their immune system. There is no record as to how effective it was to prevent them from getting the COVID vaccine. And I'm almost certain that despite the fact that people took the vitamin D and tried to boost their immune system, they may have gotten it. The only thing is that they may have gotten it, but it may not have been aggressive as somebody who never tried boosting their immune system. In terms of numbers, I really cannot answer to give specific numbers as to who took vitamin D or vitamin C to boost their system and who did not. It would be, well, it's kind of late now to even try to do that, in the sense that COVID is so, it's global. It's all over the place, basically. And it's difficult to follow numbers as to who did not get the vaccine, who has been actually taking something to boost their immune system, how effective it was. And for all you know, they may have gotten the virus and they were asymptomatic. So how do we know that the immune boosting system that they undertook was actually effective? I may have had the virus and I don't know. To be honest with you, I never had any signs or any symptoms, because I actually worked directly with COVID positive patients. I pronounced about 20 COVID deaths last year. It could be that I was taking vitamin D and I did not get it, or I may have gotten it, but again, I was asymptomatic. So it's difficult to tell whether actually boosting your system would help prevent you from getting the virus. But it's worth a try to, keep healthy.
Yes, and I think it's so important that we're addressing these questions, and I'm very grateful for the panel that you're here to answer these questions. And now Anthony Simon on Facebook Live has a question that I don't think that we can answer, but he says, why haven't there been any COVID-19 related deaths on the homeland Dominica? So I don't think that's a question we can answer, Anthony, but thank you for your contribution to the program. Now we have
Hang on, Simon. Let me
Yes, sir.
say something. Let me answer this question, this caller, because we get pretty much accurate reports of COVID from all over the world. Two things Dominica has. which would limit deaths and spread is, number one, they have low number of cases, but the most important one, they have zero community spread. Community spread is what overwhelms your hospitals and lead to death, right? So if it can come into your border, but you quarantine and you are captured and held before you can go out into the community to spread it. So that may contribute a lot to why Dominica doesn't have the kind of deaths that we see in. If you can stop it at your border, at the water's edge, then you have a better chance of surviving. Now, there are two things. One thing that determines the severity of COVID, other than your pre-existing conditions or comorbidities: viral load. The amount of viral particles that you inhale is directly correlated with the severity of COVID to you. For example, if I am in a crowd for like 3 hours, hanging out, screaming, laughing, or in church, laughing and just inhaling particles, all those viral particles, each of them are going to cells, and they are taking over your cells and multiplying inside your cells and coming out and killing those cells when they egress, get out of the cells and infect other cells. So imagine if you get millions and millions of particles because you were exposed for a lengthy period of time. If your viral load is low, as in people who are vaccinated, that is why they are not having severe illness or hospitalizations and death, because the viral load is low. Even if you got a lot, you may get a breakthrough, but once the viruses get out from inside the cells to go infect others, the immune system and all its components are sitting there to it. By the way, Carl Kofi James is my cousin. And he's sitting there gardening while they're sitting gardening in Chicago. I just want to say, you can have COVID. The viral load may have had not a severe infection, but you are still susceptible. There are people who have gotten COVID 2 or 3 times. So be careful. And as a matter of fact, there is, I think it's a Louisiana congressman who got it again. And this time he's saying it is way worse. So we don't know. And natural infections, yes, it wanes over time. The reason we get booster shots for things like yellow fever and stuff in every 10 years or tetanus every 10 is because you have the memory, the immune memory, and we just want to wake it up and make antibodies, and then it will probably go back dormant until you see it. That's
yes. Thank you. Because just give me 1 more minute. I really need to take this comment on Facebook Live because it is from a medical professional in Dominica. Unfortunately, your comment is very long, so I won't be able to read the whole of it. But Mignon Rose Shillingford, she says, my opinion to this question would be that it is very difficult to get persons to change their health behavior months, years, and sometimes never. Look at the number of persons dying from COVID-19 infections. Can we really wait to spend millions of dollars and to ask persons to boost their immunity instead of taking the vaccine? Let's look at what is happening with NCD epidemic. Millions are dying daily, millions of dollars being spent on education campaigns, skill building programs to include health policy, and what is the result? So Mignon, as a health professional, I want to thank you for that feedback and for that comment and for siding on everyone receiving the vaccine. Lambi, do you have any calls coming in?
I have a number of calls coming in.
Okay, we'll take a few more before we continue with the program.
Okay, caller, please go ahead with your call.
Hello, good evening. I'd like to touch base with my little 2 cents on that great program it have tonight there in Dominica.
Yes, go ahead.
And so, yes, my lord, well and truly, I hear everybody say certain things, but the host and the people them hosting the program, to me, all look very intelligent, and I love all the energy, and all you are good vibes. No, well and truly, right? COVID virus is not a thing we have to talk about again, because why? COVID virus there among us, and it therefore little while it don't have nowhere to go. Now, when the COVID comes, the whole world is talking that we need to get a vaccine, right? Now, the vaccine come about, and as far as I can see the vaccine working, no matter what, everyone want to say what they want to say. To me, by my understanding, the vaccine is working. Now, as the sister just said, any human being that have a weak immune system, obviously, you will get any virus very fast and quick, right? Now, if you have a strong immune system, I don't think you cannot get sick, but you'll be solid as a rock. Now, if you take the vaccine and you have a weak immune system, which means the vaccine going to be a defense in your body. Host I wrong, why right? No. When you get that defense in your body, which means anytime you get the COVID virus, if before you had the vaccine, you would have died. But now you have the vaccine, I don't see no way that you're going to die. Now, if everybody have the vaccine, as they say, I myself, I tell you personally, I know for sure, I know myself, I know my status, I know what I live in, I know how I live in, I know what I'm living for. If you take the vaccine, as I say, everybody take the vaccine. The COVID must disappear because it don't have nowhere to live. Tell you what I say that. Now, for instance, all different people talking about even society and what people in country. My lord, the whole Caribbean, as I call, and the plantation is organized by man. We're living in a world of man law and not God law. The Father say, create us in our own image and likeness. None of us are living for ourselves. Every one of us are to live for each other. I'm telling you right now, the way the world running, and some people want to have the world running, is wrong. Because really and truly, every human being is responsible for their own action. We have a dangerous virus, which is COVID. That's the worst thing I ever seen in my life. First time I see I'm in prison for doing no crime because of COVID virus. We have to find a way. As the sister say, the problem we have, a lot of people are today, doctors, maybe they're getting some money out of it. They bring in some bad news. They're not concerned about the people and them, because really and truly, all the millions of people are dying there. I sure if they have to take the vaccine there right now, I sure they would have to take the vaccine. They would have nothing to explain about. Yes.
Okay, caller. Thank you, caller. You made that point. Thank you very much.
I have to hear people calling and they don't have no message. You know, speaking, they don't even know about themselves. Because as you just say, a lot of people might be sick. They have to know their status before they even take the vaccine. Because as I tell you,
caller,
if you have other problem and you take the vaccine and you have other problem, it can maybe do you something, as you brother say, nothing not perfect. It must be have after effect. Anything you do, and it's so correct. You know what I'm saying?
Yes, thank you, caller. Thank you for your contribution. Let's take another call quickly.
Caller, please go ahead.
Good evening. Good evening.
Good evening.
Very important discussion. But I think there will be many hundreds of more discussion before this thing is over. Unfortunately, but I'm facing the facts. Now, this thing must have been discovered somewhere. It didn't fall out from heaven. Now, why is it the major democracies of the world are frightened to say where it was developed? Some people say China. I will say it's China because they've proven it already. But there's a 5-letter word which is an abomination in any language. And that 5-letter word is greed. Overnight, since this thing started, people have become multimillionaires. So while some agencies are trying to find a vaccine to stop it, there are others, the mutation keep happening all the time because it's a money-making business. You'll produce a $5 pair of shoes in, let's say, China, and that shoe will sell instead for $100. It's all money making. And you know, as I said, to be quick, there are a lot of things, but I'll be quick. People are deceitful and hypocritical. And the longer this thing goes on, is the more people say, what is the use of taking a vaccine? The more vaccine I take, this thing just keep mutating all the time. So what is the point? Somebody has to come out and say, this is the country that thing was producing, and condemn it.
Yes, thank you, caller. Thank you for your contribution. Lambi, were you saying something? We can't hear you.
Caller, please go ahead with your call.
Less than a minute, Lambi.
Yeah.
I am asking, where did the flu in America that killing thousands of people every year went to? And ivermectin and hydrogen chloroquine with zinc and aspirin, proven in Australia, proven in Spain, proven many places to kill corona in less than 48 hours. Why the vaccine and not those existing medications that there? Well, ivermectin, I think it came from Japan originally, and hydrogen chloroquine when everybody laughed at Trump. These things are killing the virus. Why they're not using it? And please, the brother that they're from Dalis, where did the American flu that killing thousands of people every year went to? Thank you.
Thank you. So Dr. Swinburne, if you want to address those concerns quickly, please, because we're quickly running out of time. So I think I agree with the previous caller that we need more of these conversations.
Moi, c'est garçon from Hot Dailies.
Dr. Swinburne.
Okay, so let's talk about the virus. Like I said, in 2008, we had SARS-1. Then in 2011, 2012, we had MERS COVID. And now we have SARS-CoV-2. Caller, when I tell you, just like I know how to go up Musha and do in Dailies and carry stuff up there, when I tell you that we were cutting that DNA and cutting that RNA, that is exactly what we were doing. We would not pass to go any further. So if somebody were to cut the virus and engineer it, which people can do, anytime any of us sequence it, because to cut DNA or RNA, you have to have molecular scissors, and they cut in certain patterns. Just like when you're building a table, you cut a piece of wood shaped like an L and put another one fit on top of it. There are different ways, different molecular scissors cut. There are about five of them, and they are tools that other organisms, bacteria and viruses use to cut our DNA so they can insert themselves. So if we were sequencing the SARS-CoV-2 genome, it would light up exactly where they cut it and pasted. We would see it. I would know where it cut. We did not see those. And to make it more convincing is that when they were looking at, there is something called you want to look at the function or gain of function or loss of function. If I do this to that virus, then what will it do? The sequence that they found in the bats, and they do have some of those exact same bats from there in China, right at Johns Hopkins, where they're doing research with CNN, even went in there and put on all their clothes to go see it, to go see the bats. The sequence in the bats are more than 99% identical. That is a specific scientific molecular term. When we say something is 99% identical, basically we're saying it's exactly the same thing. The sequence, there may be a couple of, and it's just letters. It's letters of the alphabet. They just jumbled up in different ways, but they have a specific meaning when they are lined up in a certain way, just like my name starts with S and ends with E. If I jumble those letters up, then you won't be able to tell my name. But if I put it in order, it's the exact same thing. So if it were an engineered virus, we would have been able to tell. You don't think all of us scientists are looking to see if it was something? Yes, okay. So this one came from, it's in China. They found it in China, but what about the other ones they find in other places around the world? There are other viruses like the hantavirus, like Ebola, and all those things are all over the place. And we have to be constantly monitoring them to see when they make that jump from animals to humans. They are all, and part of the problem is that we humans are starting to move into areas that were those things home. We want to move into the jungle where they are and go build developments. They don't have any place to go but back into us. Mm-hmm. And that is where so Mr. Caller, the very what you are concentrating on, I would concentrate not on where it came from, but what it will do to me if it gets me, and how can I save myself, my family, and my community from this thing that's going to kill me. It doesn't matter really. Yes, it's a good, we have to know where it came from and how, but then we're working on that. But for you, I think the most important question is, how do I protect myself and my family, my community from COVID?
Thank you, Dr. Swinburne. And in the interest of time, let's take one more comment from the Facebook Live, and then I would like to hear from each of you your recommendations moving forward before we end the program this evening. So we have David Joseph, and he says in 1917, 1918, the Spanish flu killed over 50 million people. Very true. Was there a global agenda then? That is the question. COVID-19 is almost 3 years, have not been able to kill 1/4 of the 1918 figures. How effective is the global agenda that is being spoken of? So I think we can already see that there's a lot to learn. There's a lot more information that we need to share. And so I hope that this is a conversation that we can continue to have. And I also went ahead and posted some information that addresses a lot of the questions about the vaccine and the side effects. So I went ahead and posted that on pushpast10.com. So that is PUSHPAST, the number 10. And I'm also thankful that Dr. Gebrey shared some information with me about PAHO and everything that is going on with PAHO and the recommendations. So that too as well is posted there. And I want to thank Mr. G for sending me that other piece of information. So again, pushpast10.com if you would like some more information. And before we jump into your recommendations, I just want to add my own point of view, because as a mental health specialist, you know, I think getting the vaccine is a very personal, a very private decision. And I also think that people have a right to their opinions. They have a right to their decisions. However, I believe we should be able to, we should allow people to make the decisions for themselves. You know, there's so much information out there, so much conflicting information, that I think we should just give people the space to be able to make that very private decision. So just be mindful of what you're saying to people, just be mindful of your opinions, and just allow people to make the decisions for themselves. Because here we are, we're hearing cases where people are literally hiding to take the vaccine. So they do not want their communities to be aware, because they live in an anti-vax community. So they don't want their communities to be aware. So they're hiding. And I think that is so unnecessary. So if we don't take anything else away from this program this evening, I just would like for us to give each other some space to make that decision, to think through the process for ourselves, so that we can make an informed decision. And I truly hope that the information that we have provided this evening will help you to guide that decision one way or the other, because at the end of the day, the final decision really comes down to you and what your belief system is. So with that, as we get ready to wind down the program, and I want to thank the Facebook Live folks who joined in, as well as everyone who listened to us via Q95. I want to just go around the room and get your recommendations based on everything we have shared moving forward. Dr. Gebrey, we'll start with you.
Oh, okay. Thank you very much. If you allow me a little bit about the ivermectin, which one of the callers mentioned, still we are investigating, and then there is no any conclusive evidence whether this antifungal antiparasitic drug would be working. So thank you very much again, and thank you for your listeners for joining this evening, and my colleagues and panels as well. So currently the world needs more vaccines. The point is that we could stop this pandemic if we share vaccines, and then if individuals are able to take the vaccine. That's the first important message we have to understand. Currently the Delta variant is also causing devastation in more than any other variants, with the potential to be even more dangerous, and will emerge if we don't control the virus. So how do we control the virus? Vaccines are there. We have other tools, public health and social measures, including hand hygiene, cough etiquette, and then keeping distance, covering your face, wearing a mask. All those things are very important. We have seen 4 consecutive weeks now increasing COVID-19 globally. I'm very fortunate that Dominica may not have seen an increase. That's very good. And there is no death, because most of the cases were imported. The increase in transmission have to, currently what we see are because of 4 factors. There is a circulation of the transmission of a new variant, the Delta variant. There is also social increase in the social mixing, and there is also inequality about vaccine distribution. Therefore, once we have the access to the vaccine, we better take the vaccine. And I thank you.
Yes, thank you very much, Dr. Gebrey. Thank you for being a part of this panel and for your valid contribution to the program. Dr. Adrien, your recommendations, final thoughts?
As I said earlier, Simon, we need to respect each other, individuals' choice to take the vaccine or not take the vaccine. While I do recommend and I encourage everybody to get a vaccine, I still respect those who do not want to take it. And while you do not want to take it, I would wish that you would wear your mask, wash your hands, distance yourself, take the various protocols seriously. Because it's not only about us, it's about our loved ones, maybe who we mix with, our colleagues. We're trying to protect each other. We are each other's keeper. Also, if there is no virus, we will not have the mutation. So while we have the Delta now, which is causing havoc around the world, if everybody had gotten the vaccine or people took precautionary measures to prevent themselves from getting the virus, then we would not have any mutation. So we need to stop it somewhere, but all of us need to put our heads together, put our minds together, and work together to combat that virus. Thank you for having me on the program, and I hope that our listeners and viewers would take at least some of what we had to share and make the decision and take the vaccine. Thank you.
Yes, thank you, Dr. Adrien, and thank you for always being readily available. You and Dr. Swinburne, you guys are always readily available to engage with us and to answer our questions. So we want to thank you for that. And we hope we can recruit Dr. Gebrey to be a part of our team of folks who are readily available to join us to answer these important questions. Dr. Swinburne, over to you. Are you muted?
I will end with something my grandfather in Dalis, Aaron Augustine, always said. He always used to tell us, "Éducation sans cervelle, c'est not." Education without common sense is zero, nothing, right? So Earlier this week, the governor, the Republican governor of the state of Alabama, KIV, went on TV and said, it is the unvaccinated people who are causing all of these outbreaks that we see. And then she said, I thought people had common sense. If they don't want to take care of their own selves, where is the common sense? So just like my grandfather said, education without common sense is not. Our common sense tells us, forget all what you hear. Let your common sense guide you, because it's telling you there is something that is killing people globally. That is a fact. I don't care what misinformation you can give me. People are dying. That is a fact. Number two is that for years and years and years and years and years, people have been taking vaccines, and vaccines work. When you get pricked by a nail, a rusty nail, the first thing they give is a tetanus shot. I don't know any of us who've ever gotten pricked or got caught with a sardine can when we running in the bushes back home that did not take that tetanus shot. So please, people, stop listening to folks who are trying to come out with all kind of fancy words and fancy meanings, and just apply common sense. COVID kills, the vaccine. And I wrote, if you want any question, you have any questions about this, I wrote an article for Image magazine in Dominica, and another one for the entire Caribbean. And I am convinced the only way we get out, and that was the title of the article I wrote. The only way we get out of this pandemic is with the vaccine. Believe it or not, whether you believe it or you don't, it is the way we will get out. And the people who are going to suffer, sadly, are the ones that are being led astray and given false information about the vaccines and about the whole pandemic. So please, use some common sense and save yourselves and your communities. Delis, Roso, Goodwill, Moemezo, Plita.
Yes, yes. Thank you, Dr. Swinburne. Thank you, Dr. Adrien. Thank you, Dr. Gebrey, Lambi on the console, showing over there in the studio. And I think what we're looking at is really a bigger picture, that whether we like it or not, technology is going to change many aspects of our life, including education, the way we work, our careers, and yes, medicine as well. So I think what we are witnessing is that we are not as prepared as we would like to be in terms of embracing technology. So I certainly think that we have a lot of work to do. Our work is cut out for us, but we here at Q95, we are dedicated to guiding you through the process, through all the rapid changes that are going on through the world. We are here to guide you through these processes. So we will continue to engage our experts to provide us with the guidance we will need to not only guide us through these changes, but also to address your questions and your concerns. So once again, with that, I would like to thank everyone who joined us via Q95, Wise QFM on Facebook, Push Past 10, DA Rose on Facebook, as well as via Q95, the radio station. So once again, I want to thank you for being here with us, and I want to say a pleasant good evening to you until the next program. Don't forget, I am Simone Matthew, and it was a pleasure being here with you. We look forward to continuing this discussion, and we look forward to engaging you on this topic and other topics to come. So with this, I wish you a good evening, good night. Thank you, Lambi. Thank you, Sweeney, Dr. Gebrey, and Dr. Adrien. You guys have a wonderful evening.
Good night, everybody.
Good night.
Thank you.